perfect. So this is Dr. Mike Galbraith. I'm a sports medicine physician here in the metropolis of Alberta, Canada. And Reed has been willing to donate his knee to science today. So he has a very large prepatellar bursitis with some underlying knee arthritis. And he's a very active, dedicated, long-distance runner and still enjoys hiking out in the hills. So we're going to try to relieve some of the tension from this major prepatellar bursitis. We're going to use ultrasound. So this is my ultrasound probe. And maybe Larissa, what if I had my assistant, I might have her come just over on my left side. And the interesting thing about Reed's bursitis is it's chronic, so it's really thick and it's really inflamed. It's not just a normal, real simple, got it, thank you, cyst. So I'm gonna do a little local anesthetic first of all. So you feel a tiny poke here, ready, 1, 2, 3. This is a 30 gauge needle with some lidocaine, and it kind of burns a little bit. Do you feel that burn very much?
No, not too bad.
Not too bad. I'm gonna try to be nice. I'll just go nice and slow, and I find using local anesthetic, if I go pretty slow and use a small gauge needle, usually I make good friends with Reed. So, and Larissa, can you just tap on the screen for just a second too? So there's the local anesthetic. So do a needle back there. Got it. And then already, so we've done this before. He has this thick gelatinous material that we've aspirated. So we're gonna aspirate the same thing. You can already see it coming out from that puncture site. I'm going to use a larger bore needle here. Great, and then it's already kind of auto-filling. You can just see there's that much pressure. Larissa's going to help here. And again, it's kind of nice. I can use guidance of ultrasound as I go in. These are usually quite difficult to aspirate. So she's trying. I'm going to maybe reposition and go to a different part of the cyst. Okay. So you can see it's just really, really thick fluid. I'm going to move up a little bit there. Okay, it's a different pocket. I can see in ultrasound, I can see the different pockets of his cyst and inflammation. It's just this really, really thick material. That's great. And what I might try doing, Larissa, I'm going to try to manually compress here for a second. And this would be a little bit gross. I'm going to maybe pass that back to you for just a second. Thank you. And I'm just going to manually, and can I get another gauze with chlorhexidine on it? Not to be disgusting, I apologize, Reed. She's like, wow.
I'm going to sit over here.
So that's the really, really thick, good, really, really thick gelatinous material. And that's what a really chronically inflamed bursitis can look like. Versus if it's really acute, it's very liquidy. I hope I'm not blocking the angle. So I'm kind of milking these different compartments here for a second. And I promise I'll clean up your leg when we're done. Let's see if I can get... I've learned not to put my face right down by it when I do this. Kind of like when you're delivering babies, I've learned it's always a good idea to wear a face shield and a mask, yeah. You know, we can do maybe just a blue. Good, and that's probably about all I'm going to be able to squeeze out. And now I'm going to just kind of prep that again. And then, great, and a tiny little poke here. We're going to put a little bit of cortisone in. Good, and I'll hand that back. So that's it. You did great. Maybe I'll take one more gauze, if that's all right. You did fantastic, so we'll put a Band-Aid on that. So that's not going to cure Reed's knee, but hopefully at least that'll help with some of his pain and discomfort and keep him moving. So thank you very much, Reed, for being patient.
You're welcome.